Good morning. I'm Ron Daniels, the president of Johns Hopkins University. Before we begin today, I would like to ask for a moment of silence. Our work over the next 2 days will focus on the wrenching and the pernicious effects of gun violence in America. Violence that has ravaged far too many families, schools and workplaces, places of prayer, neighborhoods and communities that dot and define our landscape. So that I ask that we remember the victims, not only in places like Newtown, Aurora, Oak Creek, Tucson, and Blacksburg, but victims in Baltimore, Detroit, New Orleans, and Oakland, and countless other communities, large and small, across this country. Thank you. On behalf of myself and Mike Clagg, the Dean of the Bloomberg School of Public Health, who is traveling overseas, I'm honored to welcome you today. This summit was conceived scarcely 3 weeks ago in the wake of the harrowing events that transpired in Newtown, Connecticut. Daniel Webster and Jan Vernick of the Johns Hopkins Center for Gun Policy and Research were determined that the debate over gun control, which must follow from this event, be informed by the best research and analysis from across our country and indeed the world. And so, for the last several weeks, they have devoted virtually every waking moment, and in fact, there have not been many moments in which they have had a chance to sleep, to organizing this conference. To the two of them, and to colleagues and staff at the Bloomberg School and elsewhere in our university who have supported them, thank you for your extraordinary leadership. There is, of course, a distinctive and noteworthy twist to this summit, namely that the distinguished experts who have responded to Daniel and Jan's invitation aren't merely participating as speakers, but as authors. That is, each of our speakers has agreed to submit a chapter that elaborates on their remarks in a book to be edited by Daniel and Jan and published by the Johns Hopkins University Press in 2 weeks' time. Indeed, I'm told that you can pre-order the book for, I said $10. Jan corrected me and said, no, it's $9.95 on Amazon.com, and we know sales are moving briskly. This book will constitute a state-of-the-art source book for policymakers grappling with the policy options needed to respond effectively to gun violence. By the end of the month, we're committed to seeing a copy of the book on the desks of each and every member of Congress and of appropriate officials in the executive branch. That is no small feat. Accordingly, I want to thank our speakers and the press for their Herculean efforts in contributing to this summit and to the book that follows. As you well know, we gather exactly 1 month to the hour after the horrific, unfathomable massacre in Newtown. The specter of that event will weigh heavily on our discussions and on all the debates currently raging in Washington. But it is also important to note where we are gathering. In the past year alone, there were more than 2,700 gun-related crimes in Baltimore. Sadly, this is a place where gun violence is not a surprising event, but in far too many quarters of our city, a tragic and all too commonplace part of life. On this aching anniversary, gathered in a city that must contend daily with the unforgiving toll of gun violence, the importance of this summit cannot be overstated. Because our conversations over the next 2 days will take place against the backdrop of a bleak record of stunted policy reform in this area, it is tempting to regard this summit as one more exercise in futility. Essentially, the skeptic's fear is that good ideas for gun policy reform are no match for the formidable interests that oppose gun control legislation. This is so even after an event as cataclysmic as Newtown. Yet today, I urge a more optimistic view that is predicated on the belief that we are not slavishly tethered to the current matrix of inadequate national gun laws. Despite a long history of failed legislative and policy reform, of opportunities inexplicably squandered, and of tepid half measures adopted, progress is possible. And my optimism stems from two sources. First is the fact that in other countries have adopted non-trivial policy changes in response to gun violence that have improved public safety without trenching unduly on personal liberty. It is true that jurisdictions like Australia, Britain, and Brazil have never had constitutional guarantees protecting individual rights to bear arms, that their political institutions are different than ours, and that gun culture is an alien concept. But there are telling lessons to be gleaned from the approaches these countries have taken to address successfully the wanton loss of life from gun violence. We can and we must learn from the experience of others. The second source of my optimism lies in this country's history. In recent decades, there is no denying the sea change in public sentiment that has undergirded public health policy reforms in areas as diverse as seatbelt usage, drunk driving, and public vaccination. Big tobacco presented a seemingly impregnable barrier against regulation until it happened. This is often the story behind monumental changes in U.S. policy. Consider the Civil Rights Act of 1964. It took Lyndon Johnson's legislative genius to prod the Senate forward, beat back resistance, and overcome what had seemed to be an unshakable logjam. In short, in our lifetimes, we observed enough non-trivial policy change to recognize that the apparent iron grip of status quo forces can be shattered and policy can progress. In the next few weeks, we can anticipate and hope that the debate over the effective regulation of guns and the appropriate balance between individual rights and civic obligation will command sustained and serious attention from our political leadership. Advocates will mobilize as lobbyists ply their cases, and politicians will spar over the issues. We know that. And in this unruly mix, universities like ours can and will discharge a critical role in providing principled scaffolding for this debate. Here at Johns Hopkins, our scholars have been investigating the public health effects of gun violence for well over 2 decades. For the past 17 years, the Center for Gun Policy and Research, envisaged by our colleague Steve Terrett, has provided a home for that study, producing nationally recognized research and recommendations aimed at understanding and curtailing the impact of gun violence. By now, the research produced by the Center and others, we have accumulated a wealth of knowledge, and we hope much of it will come to the fore over the next 2 days. This summit has convened scholars and advocates from across fields and indeed across the world. We want to use this opportunity to cut through the din of the shrill and incendiary, the rancorous and the baseless, by identifying specific recommendations, evidence-based analysis shows will work and can be rendered congruent with principle and with our legal institutions. Of course, any possibility of change depends on a complex alchemy of ideas, shrewd political strategies, and inspired leadership. And in the gun policy debate, as indeed in so many other issues of enlightened public health policy, there has been no more effective leader than the namesake of this school, Johns Hopkins graduate, New York Mayor, Michael Bloomberg. Mayor Bloomberg convened the first Mayor Summit on Illegal Guns in April 2006 at Gracie Mansion. Following the event, he articulated the mayor's shared intention to crack down on illegal guns using, quote, every tool at their disposal. After all, he concluded, if Congress won't take the lead, we have to. And so he has. In the nearly 7 years since, he has made the removal of such weapons from the streets of New York a primary focus. He has led the growth of Mayors Against Illegal Guns to include more than 800 municipal leaders of all political stripes and nearly 1 million followers. And as a defender of the Second Amendment, he has focused on the reasonable, calibrated restrictions that will make the greatest difference for public safety. In fact, the mayor, standing alone, may comprise yet a third source for my optimism. In public health issue after issue, from tobacco to obesity, he has exhibited courage, stamina, and focused determination when working to enact life-saving policy changes. His ideas are grounded in research and data, and his commitment is absolute. In short, I would not want to find myself on the opposite side of an issue in which he has invested his considerable intellectual and political skills. Mayor Bloomberg will speak in just a moment. At this point, however, I would like to invite to the podium Governor Martin O'Malley. Wait a sec. A former mayor of this great city, a longtime supporter of Johns Hopkins, and a national leader in smart data-driven efforts around public safety. Violent crime in Maryland has fallen by more than 24% since the governor was elected to office in 2006. Under his leadership, state officials have participated actively and aggressively in task forces and in other partnerships with Baltimore and other municipalities. The state created assessment tools to identify individuals in community supervision with the greatest propensity to commit future violent crimes and launched collaborations to share relevant criminal justice information with neighboring states, including Virginia, DC, Delaware, and Pennsylvania. The governor has spoken out in support of efforts to prohibit assault weapons, and just this last week predicted that Maryland's General Assembly will ban such guns during the current legislative session. All you have to do is look at today's Washington Post to see the scope of his commitment. Maryland's session started last Wednesday, so I know the governor has just a few things on his plate. His decision to join us here today is clearly a reflection of the deep commitment he has to this cause. Governor O'Malley, welcome back to Johns Hopkins University.
Thanks a lot. Thank you.
Thanks for being here.
My honor. Thank you. Mr. President, thank you very much, and thank you for the amazing work that goes on here at Johns Hopkins in so many realms, including here at the Bloomberg School of Public Health. It's always a great honor to be here, especially to play warm-up act to Mike Bloomberg at Johns Hopkins. Proud alumnus, very few of your sons, I dare say, Mr. President, have done quite so much for Hopkins as Mayor Bloomberg has. He's been also a terrific friend to the city of Baltimore. And we were here together just this past April, in fact, to dedicate the Charlotte R. Bloomberg Children's Center, named in honor of his mother, which looks, I think, like one of the most handsome new buildings in Baltimore as I drive by. Look, a great American once said that no nation whose citizens fear to walk their own streets is healthy. And there is a sickness in our country, and that sickness is gun violence. It's fitting, therefore, that we're here at the Bloomberg School because gun violence is truly a public health issue. It's about the health of our cities and our towns. It's about the health of our neighborhoods and our economy. It's about the health of our schools and our school children and our communities and the health of our neighbors. Mayor Bloomberg, the people of New York have seen, is an effective, results-oriented mayor, one of the most effective, results-oriented mayors ever to serve New York, or dare I say, any city, creating jobs, expanding opportunity, improving city schools, launching America's largest affordable housing initiative. Well, quite honestly, everything they do in New York can be said to be the largest initiative, but I should say also largest and one of the most innovative affordable housing initiatives, and also fighting crime, really showing us, the people of New York have shown the people of Baltimore, that it is possible to make a safer tomorrow, that we do not have to resign ourselves to the circumstances of the way things have always been or what we've never been able to do in the past, and that, in fact, we can save lives. And each life is precious. Each life is important. And if you save just one life, it is as if you have saved the entire world. The people of America have also recognized something else that's very important to Mike Bloomberg, and that is that he is not primarily partisan. He is primarily about pulling people together to do the practical things that actually works, which is also the definition of what it takes to be an effective mayor. There is no Democratic or Republican way to fix a pothole, is there? Or any Democratic or Republican way to make sure that the alleys are clean or that the trash gets picked up. You see a problem, you bring people together, you fix it, and you then see measurable results. And in this case, the measurable results that we will see are lives that will be saved. This has been Mayor Bloomberg's driving argument when it comes to preventing gun violence. Politically speaking, this is certainly not an easy issue for many elected figures. The mayor courageously chose to step up again and again, bringing other like-minded mayors together, including our own courageous mayor, Stephanie Rawlings Blake. And he did so consistently. And his leadership really matters now, because with the tragedies that have happened across our country, in Colorado, in Wisconsin, and most lately in Connecticut, there is a wider envelope for accomplishing the art of the possible, for putting in place common sense things that can prevent the sort of gun violence that has taken too many lives from us. All of us are here today because we agree that this issue is of paramount public safety importance. And there is no more important responsibility that any government has than protecting and safeguarding the public safety of its citizens. Over a 10-year period of time, 2 of the 3 major cities in America that achieved the biggest reductions in driving down violent crime have been New York, and also just behind New York has been Baltimore. I believe New York was number 2 over a 10-year period. Baltimore was number 3. So preventing violent crime, locking up the bad guys, keeping assault weapons from falling into the hands of disturbed people who are a danger to others, these are not barometric pressures. These are not weather forces. These are not conditions brought about by the Gulf Stream. These are human problems, and so too are their solutions. Mayor, you'll be pleased to hear that in Maryland we are taking up this issue again in this year's legislative session. And I do believe that this year we will have success. Later this week, we'll be introducing a comprehensive legislative package that looks not only at weapons and the licensing of weapons and background checks, but also at schools. We're joined here by Lillian Lowry, our superintendent of state's school system. We'll also be looking at health and mental health. We're joined by Josh Sharfstein, our commissioner of health and mental hygiene in the state of Maryland, also joined by Marcus Brown, our superintendent of state police. So this will be a comprehensive legislative package to prevent gun violence. And it addresses not only the guns, but also mental health and school safety. Briefly, it will ban military assault weapons that have no place on the streets of Baltimore or on any other neighborhood in our state. And it will also limit the size of magazines in order to make it harder for criminals to gun down in succession police officers or school children. It will secondly have a common sense licensing requirement for handguns that respect the traditions of hunters and sportsmen. Third, it will contain real substantive reforms to improve mental health services. Reforms like more timely data sharing, investments in better treatment, and the creation of a new Center for Excellence on Early Intervention for Serious Mental Illness, so that we're able to utilize more effective early intervention strategies. And finally, it will invest in our schools to improve the safety of their facilities. So many of us have visited schools, and we know that with the primary mission being the educational mission, that there is a wide spectrum when it comes to the safeguards in place on simple things like the doors being locked and visitors being checked in and the like. So we will be creating a fund within our capital schools budget. We're one of only about a dozen states that invest in school construction. and that fund will help us to bring schools up to higher standards. We'll also be creating a Maryland Center for School Safety that will bring together law enforcement with school officials so that we actually have some better advice for school officials on the things we can do to better safeguard the campuses of our schools. Conclusion, as I get to introduce our very honored and accomplished guest. Look, neither Mayor Bloomberg nor any of us in Maryland are seeking to ban all guns. At the same time, we know that it makes absolutely no sense when you look at the level of carnage on our streets from guns to blame every factor but guns. If we're going to have a comprehensive approach, well, then let us be comprehensive, including comprehensively looking at the licensing requirements for guns. We need a comprehensive approach that puts the focus on the practical, common sense things that we can do together to save lives. There may not be, perhaps there is no way to completely prevent the next Newtown tragedy. But then again, perhaps there is. None of us can predict the future. None of us can properly assess the value of preventive programs that keep another tragedy from happening. And yet we know every life is valuable. And therefore, that's why our inability to predict the future and the ability to fully pinpoint the value of preventative actions cannot be an excuse to keep us from doing common sense things that common sense tells us can work. So this is not about ideology. It is about human dignity, the dignity of every individual life, the dignity of every one of those little kids in Connecticut, the dignity of every child and every person in the United States of America. So it is with great honor that I introduce to you a man of effectiveness and a man of great political courage, Mayor Michael Bloomberg of the great city of New York.
Thank you. Thank you. Governor, number one, thank you for rearranging your schedule to be here today. The governor, you should know, has always been a strong leader on gun violence. I remember meeting him in his office in Baltimore before I was mayor, when he was mayor of this great city. And he was focusing on tackling gun crime then, and certainly as governor now, he is doing exactly the same thing for the people of Maryland. Maryland's one of those states that has an urban, suburban, and rural part of it. It has all of the problems that we have across this country: public health, public safety, education, economics, and it also has something that is very valuable. It happens to have a great governor, and I've been a big fan of Governor O'Malley's for a long time, and I just wanted to also thank you for your support for Johns Hopkins. It's a great asset for Baltimore and for Maryland, but it's a great asset for this country. And you and your other elected officials in Annapolis deserve a great deal of credit for recognizing that, and the support that you've given to Hopkins for a long period of time is deeply appreciated. And I hope that we have paid it back and that you are getting something for your money. It's great to be back at my alma mater, Johns Hopkins. President Ron Daniels called me a few weeks ago and said, "We're putting together the best minds in the world on gun violence to produce a conference and a book. And will you help keep it off?" Kick it off. Well, he didn't have to ask twice. The fact is that they were able to pull this conference together so quickly, I think does show the dynamic and energetic commitment to scholarship and public service that I've always thought really defines the Hopkins spirit. It is clear that we meet today at a critical and I think a hopeful moment. Just 1 month ago, at roughly this time, on December 14th, a deranged young man pulled into the parking lot of the Sandy Hook Elementary School in Newtown, Connecticut, and then shot his way into a building with a high-capacity semi-automatic rifle. and the slaughter of 6 adults and 20 children really broke the heart of the country's heart because for many Americans, this is the straw that has broken the camel's back. Since the Sandy Hook massacre, you should know that more than 100 mayors from across the country have joined our bipartisan coalition that we created called Mayors Against Illegal Guns. That brings our total number of mayors involved to more than 800. And as of this morning, roughly 1 million Americans have also signed onto our coalition's I Demand a Plan campaign against gun violence. And this week, I hope as soon as tomorrow, Vice President Biden will announce his recommendations for action to the President. I've spoken with the Vice President numerous times since the Sandy Hook massacre, and he knows that as horrific as Sandy Hook has been and all the other seemingly endless episodes of mass violence, we experience that level of carnage or worse every single day across our country. Because every day of the year, an average of 33 Americans are murdered with guns. Here's another way to think about what that means. 1 week from today, President Obama will take the oath of office for his second term. And unless we take action during those 4 years, some 48,000 Americans will be killed with guns, nearly twice as many people as were killed in combat during the entire Vietnam War. When I've talked with the Vice President, I have made it very clear that our bipartisan coalition of mayors is supporting 7 measures, 3 that need legislation and 4 that require only executive action. And we're hopeful the President and Vice President will support all 7, and I just wanted to touch on each of them briefly. First and most urgently, we need the President and Congress together to require background checks for all gun sales, including private sales at gun shows and online. These private sales now account for more than 40% of all gun sales nationally, which means that in 2012 alone, there were more than 6 million gun sales that happened with no background checks. Many of those guns being sold are handguns, which are used in about 90% of all firearms murders. And across the United States, more than 80% of gun owners and more than 90% of Americans support requiring background checks for all gun sales. So there's really no debate here. It's common sense. We have laws on the books that require a background check when dealers sell guns. It's time for the President and Congress to make that the law of the land for all sales. 40% where the law does not apply to means the law is basically a sham. Second, Congress should make gun trafficking a federal crime. In New York City, 85% of the weapons that we recover from crime scenes come from out-of-state sources. But federal laws designed to curb illegal sales across borders are incredibly weak. Criminals who traffic get a slap on the wrist. Now, we've made New York the safest big city in the nation, in part by adopting tough gun laws and proactively enforcing them. Every state in the union has citizens killed by guns coming from another state, and every state is powerless to stop the mayhem. Until Congress gets tough on trafficking, guns will continue flowing to our streets from states with much looser gun laws. The third legislative measure that the White House should support is limiting the availability of military-style weapons and high-capacity magazines with more than 10 rounds. These guns and equipment are not designed for sport or home defense. They are designed to kill large numbers of people quickly. That's the only purpose they have. They belong on the battlefield, in the hands of our brave, professionally trained soldiers, not on the streets of our cities, suburbs, or rural areas, as retired military leaders like Colin Powell and Stanley McChrystal have said. Many of the weapons in this category were previously banned under the federal assault weapons law that expired in 2004 and that was incidentally first initiated and passed by Joe Biden. So he's the right person for the president to have appointed to come up with what we should do next. Regulating assault weapons certainly falls within the bounds of the Second Amendment, and so does everything else we're urging. This is not a constitutional question. It's a question of political courage. The Supreme Court, the one that defines what the Constitution means and says, has ruled that reasonable regulations are consistent with the Second Amendment. So when the gun lobby raises the Second Amendment, it is nothing but a red herring. It's time for Second Amendment defenders in Congress to call them on it. The three measures that I just mentioned require background checks for all gun sales, making gun trafficking a federal crime, and limiting military-style assault weapons and high-capacity magazines will require leadership from both the President and members of Congress. But there are other steps that President Obama can take without congressional approval at any time he chooses with just the stroke of a pen. Vice President Biden understands this, and we hope his recommendations will include at least these 4 steps that we've urged him to do. First, the President can order all federal agencies to submit the relevant data that they have to the National Gun Background Check Database, because every missing record is a potential murder in the making. If the data isn't in the database, those people that do use the database don't get what they need, and gun sales can go ahead in cases where we all agree and federal law says they shouldn't. Second, the President can direct the Justice Department to make a priority of prosecuting convicted criminals who provide false personal information during gun purchase background checks. Yes, even criminals go and buy dealers where they know there's going to be a background check, except that they lie. As a matter of fact, during 2010, there were more than 76,000 cases referred by the FBI to the Justice Department. Do you know how many were prosecuted out of 76,000 in 2010, the last year we have data for? 44. Not 44,000. 44 out of 76,000. This is a joke, and it's a sad joke, and it's a lethal joke. These are felony cases involving criminals trying to buy guns, and yet our federal government is prosecuting less than 0.1% of them. It is shameful, and it has to end, and the President can do it by just picking up the phone and saying to his Justice Department, "This is your job. Go do it, or I'll get somebody that will." The third, President can make a recess appointment to head the Federal Bureau of Alcohol, Tobacco, and Firearms. The ATF, as it's called, hasn't had a director for 6 years. Can you imagine how much outrage there'd be if we'd been without a Homeland Security Secretary for 6 years? This is as much a public safety threat as it would be if there weren't a Secretary for Homeland Security. And if Congress keeps blocking the ATF appointees, all the President has to do is make a recess appointment. It is relatively easy, and it has been done many times, to go around Congress. You can't have an agency without somebody running it that's going to do the job that it was created for, and that job is to protect everyone in this room, everybody in this city, state, and country, including those that we love the most, our children, and those we have the greatest responsibility to, the police officers who run into danger when the rest of us are running the other way. Think about it. If Congress specifically said, "Don't tell the public what's killing our kids and police officers who are trying to protect us," would you have a problem with that? Of course you would. The President, and this is our 4th recommendation, can stop supporting what's called the T-Hart order. T-Hart was a congressman from Wichita that got the Congress to pass a law that keeps the public in the dark about who are the gun traffickers and how they operate. There can be no excuse for shielding criminals from public view. At the bidding of the gun lobby, Congress has tied the hands of the Bureau of Alcohol, Tobacco, and Firearms and has prevented it from releasing critical data to the law enforcement authorities and the public. And unfortunately, the ATF is not alone in getting gagged by Congress when it comes to the issue of guns. Today, our bipartisan coalition of Mayors Against Illegal Guns is releasing a report called Access Denied, detailing how Congress, bowing to the gun lobby, has systematically denied the American people access to information about guns and gun violence. Most egregiously and outrageously, Congress has severely restricted the scientists at the Centers for Disease Control and Prevention from studying the epidemic of gun violence, and they've put similar restrictions on the scientists at the National Institutes of Health. Congress has no business dictating what public health issues scientists can and should study. What are they afraid of? You're sitting here at Johns Hopkins. Our motto is, "The truth shall make you free." When elected officials try to muzzle scientific research and bury the truth, they make our society less free and less safe. Today, because of congressional restrictions, CDC funding for firearms injury research totals $100,000 out of an annual budget of nearly $6 billion. The National Institutes of Health is estimated to spend less than $1 million on firearm injury research out of an annual budget of $31 billion. To put that in perspective, NIH spends $21 million annually researching headaches, but it spends less than $1 million on all the gun deaths that happen every year. And if that doesn't give you a headache, it should. There are 31,000 gun deaths every year in America, including about 19,000 suicides, and many of them are children. Every parent's nightmare. In New York City, I'm happy to say, I don't know that it should be happy, but I guess I'm pleased to say, our suicide rate is less than half the national average. And one of the big differences is we have in New York tough gun laws. And nationally, 51% of suicides are by gun. In New York City, it is only 16% of our suicides. Now, the gun lobby callously says that someone who wants to kill him or herself will find a ways to do it. In many cases, they are tragically wrong. We can prevent thousands of these senseless suicides with smart gun regulations, and we're proving it in New York City. Unfortunately, American scientists are not the only people that Congress has attempted to silence. In 2010, again at the gun lobby's bidding, Congress included language in a funding bill that prevented military officers and doctors, as well as mental health counselors, from even discussing firearms ownership with severely depressed service members. There is a suicide crisis going on right now, as you've read about, I'm sure, in our military. It's tough being overseas. It's tough seeing and doing what we ask our soldiers to do. We have an all-volunteer army, but they come back, and many of them really do have a problem. Congress, instead of trying to help, is just doing everything it can to make it worse. Our men and women in uniform deserve better. Thankfully, I will say that after mayors and retired military leaders urged Congress to rescind this prohibition, they did, but only last month, and only after too many men and women in uniform have taken their own lives with guns. Enough is enough. It's time for Congress and the White House to put public health above special interest politics. And it's time for Congress to stop gagging our scientists, military leaders, and law enforcement officers and stop trying to hide the truth from the American people. And that's why this conference and your work is so important. And I think it's very fitting that this conference is being held here at the Bloomberg School of Public Health, where so much outstanding and important work is being done in areas ranging from malaria research and environmental health to tobacco control and road safety. It's all designed to, as we say, protect health and save lives, millions at a time. Reducing gun violence will have that kind of an impact too. So I want to thank the Bloomberg School of Public Health Dean Dr. Michael Clegg and Daniel Webster, Director of the school's Center for Gun Policy and Research, for hosting this conference. You know, a few years ago, Dr. Webster conducted a study of an initiative we undertook in New York City, identifying the most problematic out-of-state gun dealers based on crime data, conducting undercover operations of their sales practices, and suing those that sold guns to straw purchasers. Straw purchasers are those who lie about who is the actual purchaser of the gun and stand in for somebody that could not pass a background check. 24 of the most problematic dealers settled or were put under a court monitor. And Dr. Webster found that in New York City, the likelihood of recovering a gun at a crime scene from one of these dealers almost overnight dropped by 84%. 99% of the gun dealers in our country do obey the law. 1% don't, and those are the ones that we have to go after. And the results are dramatic and almost instantaneous. Our investigation never would have happened without the data that allowed us to identify the problematic dealers. And yet, if it were up to the NRA, we would never have had access to it, and more guns would have flowed onto our streets, and in all likelihood, more people would have been murdered. The undercover investigations we conducted were just one example of how we've worked to crack down on gun violence. At our urging in New York, our state legislator enacted the toughest penalties in the nation for illegal possession of a handgun, a 3.5-year mandatory minimum prison sentence. We've also worked with our city council to adopt a law enabling the NYPD to keep tabs on gun offenders in our city, just as they track sex offenders. We enforce those laws and other laws rigorously, and that's a big reason why New York is the safest big city in the country. In the year that just ended, New York City had the fewest murders in nearly half a century, when comparable records started to be kept back in 1963. We've never had a year remotely as safe as the year we just had. As hard as we worked, however, and as much as we've achieved, the reality remains in New York that during 2002, there were still 418 murders in New York City, and a lot of the people that were killed were kids. And while shooting incidents are down in New York City as well as murders, I can tell you that on the Thursday night last, I visited 3 NYPD officers who'd been shot by criminals in 2 separate incidents. Thankfully, the officers are all expected to fully recover. But I think that night really does demonstrate a flaw in the argument we've heard lately. The argument is the solution to bad guys with guns is good guys with guns. The problem is that sometimes the good guys get shot. Sometimes, in fact, they get killed. And I think the hardest part of my job, the part that I dread the most as mayor, is talking to the family of a police officer at a hospital to tell them that their husband, wife, mother, father, son, or daughter won't ever be coming home again. The tragic fact is that across America today, fathers and mothers, wives and husbands, friends and neighbors will experience that kind of pain and loss in their lives because of gun violence as well. The rate of firearms homicide in America is 20 times higher than it is in other economically advanced nations. We have got to change that, and it has to start this week with real leadership from the White House. So if you haven't done so, go to demandtheplan.org and join our campaign for gun safety reform. Or call your senators and your congressmen from the great state of Maryland and say, you know, we're not going to take this. And even if you vote the right way, your associates in Congress aren't voting the right way. And since I don't get a chance to influence them, but you want my vote, you do something about it. It is your responsibility to do it as much as it is the responsibility of the other senators and the other congressmen. So thank you for coming to this conference. Your work here really is in the great tradition of your host, the best public health school in the nation, if you'd pardon me and permit me to say that. Let us hope that it gets the attention that Washington needs to pay it. This is one of the real big differences between what we have today and a safe, great future for our kids. Thank you, and God bless.
Thank you so much, Mike. Those remarks just reinforce the great sense of pride and affection we have in you as a son of this university. Your remarks, as always, a clarion call to action, courageous, lucid, passionate. Thank you so much for being here. Governor, thank you so much for your remarks, and thank you for leading our state and for the initiative that you announced today, and we look forward to seeing it be quickly passed in Annapolis. I want to let all of you know that the governor and the mayor have, of course, rearranged their schedules to be here and participate in the summit, and they now have to address other pressing commitments. So on behalf of all of us, we understand that you have to take leave of this conference, but we do thank you so much for your participation. With that, I would like to now turn the program over to Daniel Webster, Director of the Johns Hopkins Center for Gun Policy and Research. Earlier, I offered, and will have many opportunities over the next 2 days, to offer appreciation for the extraordinary energy that he and Jan Vernick have exerted to ensure the success of this summit. We're in for a wonderful and very provocative program that hopefully will help contribute to the possibilities for meaningful political change in our country. Daniel, can I call you to the podium to kick off the summit?
Thank you, President Daniels, for your eloquent words and your leadership on this important problem. What I want to do here, I know we're getting behind schedule, but I just want to very briefly do a couple of things. First of all, I want to extend my enormous gratitude to all of my colleagues who have stepped up to the plate to come and write for this book and present at this meeting. Jan and I made calls right around the holidays and said, could you please drop everything you're doing and help us on this important mission that we have to bring the best scholarship to this critical problem at this critical time. I didn't get a single no. And it really says something about their commitment to this problem. And also just want to extend my gratitude also to the just fabulous staff of the school here who have made all of this possible. I want to now just very briefly just tell you what this is, just so you know where we're going. We appreciate the great political leadership that we just heard now. The remaining program, this is an academic situation here. We're going to bring the evidence to this problem. And in some ways, I can think about this sort of as, and maybe this makes me feel a little more calm, is a seminar for our policy students of how you can approach a problem. You look at the evidence about the nature of the problem. What do we know about the effectiveness of different strategies to address that problem? What are the legal issues that we need to be mindful of as we develop our strategies? And then finally, what's the public support for those strategies? We're putting all of that together here in this summit that we think will really benefit the current discussion going on in Washington and in state capitals all around our nation. So we are going to start the program now. I'd like to ask the presenters on our first panel to please take their seats. And I just want to say that there's information on the website about each of the bios of our speakers. I first thought I could say this is an all-star cast, but then I started thinking, well, many of these people aren't just all-stars. They're like Hall of Fame as far as researchers in gun violence. So we are going to start our first presentation with Dr. Matthew Miller. Because I can't go on and on, I'm going to say one sentence about each speaker. Dr. Miller is a preeminent expert who has published numerous articles that address the question he's going to address today, which is, what is the relationship between gun availability and violent death? So I'm going to turn it over to Dr. Miller.
Good morning. I'd like to start by thanking Daniel and Jan for organizing this tremendous conference, and to Susan for taking care of all the amazing logistics that made it possible. I'd also like to thank Mayor Bloomberg for his abiding commitment to this issue. This morning, I'm going to talk about the relationship between firearm availability and lethal violence. I'll start by giving you a sense of how we in the United States compare to other high-income countries, and then look at the large disparities in lethal violence within the United States. As Mayor Bloomberg pointed out, most of the firearm suicides in this country are most of the firearm deaths in this country are firearm suicides. There are, in fact, almost twice as many firearm suicides as there are firearm homicides. In 2010, the last year for which we have data, there were 19,000 firearm suicides and about 11,000 firearm homicides. There are almost as many Americans who die from gunfire as die from motor vehicle crashes. And for Americans under 40, more die from gunfire than die from any specific disease. Compared to other high-income countries, the United States has a uniquely huge lethal firearm problem. It has been said that a country can be judged by how well it takes care of and looks after its most vulnerable members, its children. By that measure, we don't look very good. This slide is meant to give you a sense of the difference in lethal violence in the United States compared to other countries in Western Europe, Japan, and elsewhere. For children 5 to 14 years of age, in the United States, they are 13 times as likely to die from a firearm homicide, and they are almost 8 times as likely to die from a firearm suicide, and 10 times as likely to die from a firearm accident. In this study, the United States comprised about 1 out of 3 people, but almost 9 out of 10 children who died a firearm death lived in the United States. There is no evidence that our children are more careless, that they're more suicidal, or that they're more violent. But they are dying by gunfire. Why? I'm going to first talk about the relationship between homicide and firearms. The first thing to get out of the way from the start is that we are not a more violent nation than other high-income nations. We are not a more violent society. We don't fight more in school, and we do not commit more violent crimes. It's a mistake to conflate lethal violence with overall violence. The next slide is meant to demonstrate that. If you look at the rates of violent crimes in the United States and compare them to other industrialized high-income countries, what you see is our rates of car theft, of burglary, of robbery, of sexual assault, and of all violent crimes. Falls right in the middle. There are other studies that look at whether kids in the United States are more likely to get into serious fights at school. They're not. There are other studies that look at rates of mental illness in the United States and ask, are we more mentally ill? Do we have higher rates of suicidal behavior, mental illness, drug and alcohol problems? No, we don't. But what we do have is more guns in civilian hands, especially handguns. We have much more permissive gun control laws, and we have more homicides. Here's another example of how we compare to other countries. If you look at the last column, you see that we have more guns than other industrialized countries. And this measure does not actually show you the great disparity in handguns, which are the guns that are used, as Mayor Bloomberg has said, in most of the homicides. Our firearm homicide rate, as you can see, is an order of magnitude higher than it is in these other countries. Our rate of homicide with non-gun mechanisms, knives and bats or whatever, is pretty much right where they are in the other high-income countries. The net effect, the column on total homicide rates, is that our homicide rate is more than twice as high and sometimes 4 times as high as these other countries. We're not more violent, but when we're violent, we kill with guns. This is a slide that my colleagues Deb Azriel and Kathy Barber helped me pull together from data that are not readily available. And what it's meant to show is this. Where do the guns come from that are used when people die by gunfire in this country? And the big picture here is that for kids, for older people, and for women, the guns that kill them are household guns. They die in the home, and to the best of our knowledge, the vast majority of these guns are legally owned. They're not trafficked. And we don't have good data on that, but that's the general suggestion. Now, for men who are 15 to 30 years of age and who are dying on the street, that's a different question. And so when you're thinking about the science, does the availability of guns in people's homes lead to an increase in the likelihood that they're going to die? You have to ask, what are the guns that are killing these people? Where do they come from? For children, for older people, and for women, they come from the home. For young men, they're often occurring in the street. Okay, so in looking at the totality of the literature that has been developed over the past 30 years, individual level studies and studies that look at areas, compare them to one another, ecologic studies, what we find is that where there are more guns, there's more death. There's more homicide, there's more suicide, and there are more firearm accidents. These studies have taken pains to try to control for differences between homes with and without guns, states with and without, states with more and states with fewer guns. And by taking these factors into account, they've tried to render apple-to-apple type comparison, like-to-like comparisons. And what I'm going to show you is a collection of states that have high levels of gun ownership and a collection of states that have the lowest levels of gun ownership. It's meant to illustrate the magnitude of the difference in lethal violence in places where there are many and few guns. In thinking about what I'm going to show you, remember that this is backed up by methodologically rigorous studies that have controlled for all of these various factors at the state and local level as well as at the individual level. Okay, so here's the demonstration. If you rank states from those with the highest level of gun ownership to those with the lowest level of gun ownership, and then you collect those with the lowest level of gun ownership up to a point where you have 350 million people over an 8-year period, and you do the same thing with the high gun states. So now you don't have to worry about rates. You can compare people, because we have the same number of people in the high gun states as in the low gun states. Let's see how we're faring. The high gun states had a population, 50% of the people who lived in high gun states lived in homes with guns. 1 out of 2 homes in the high gun states had guns, 1 out of 6 or so in the low gun states. They did not differ in their rates of mental illness. They did not differ in their rates of suicidal ideation. They did not differ markedly in their rates of violent crime. Now let's look at the lethal consequences of living there. Okay, homicide. For women, in the high gun states over that 8-year period, there were over 3,000 women who were killed with guns. There were about 1,000 who were killed with guns in the low gun states. The number of women who were killed with methods other than guns was not drastically different. The net effect was that there were 6,000 women in the high gun states who were murdered, compared to about 3,000 women in the low gun states. A difference of 3,000 lives, a ratio of 2. You can look at the children and you can look at older people, and what you see is the same basic story. Now, what about for men who are 15 to 29? Remember, they're not dying in the home. They're dying more often away from a home. And here, the evidence is not as striking, but it's still there. There are more men who are dying in the high gun states by gunfire, 7,000 compared to 5,000. Not that big a difference for the non-gun homicide rate, and a difference of almost 2,000 lives, even among this group of men who are dying more often in the street than in their homes. What about suicide? As I said, almost 2 out of 3 firearm deaths in this country are suicides, and these are all, by and large, taking place in the home with guns that have been there for a long time. The case control studies done by several of the people here in the audience have controlled for various measures of psychopathology, depression, alcohol, drug abuse, suicidal behavior in general. And what these studies find is that people who live in homes with guns are not more suicidal. They don't have higher rates of mental illness. What they do have is higher rates of dying by suicide. And the reason the rates are higher is because they're dying more likely from firearm suicide. They are not dying at higher rates from non-firearm suicide. The risk of a gun is not only associated with the person who bought the gun. It's a reasonable critique of the literature. If I bought a gun, maybe I bought it because I was suicidal, and you're going to find more guns when you do a study. But my kid didn't buy the gun, and my wife didn't buy the gun, and the relative risk for them is also high. In fact, it's even higher for adolescents than it is for the gun owner. And there's a hierarchy of risk. Just as the more cigarettes that you smoke, the more likely you are to die from lung cancer, the more unsafely you store your guns, the more likely your kid is going to commit suicide with that gun. All right. Here's a slide that I've put together along with my colleagues, Deb Azriel and Kathy Barber and David Hemingway. And what this is supposed to show you is how you can actually dissociate rates of mental illness from rates of completed suicide. What this graph shows you is that it graphs the states from left to right in increasing order of the rate of suicide, death by suicide. What you see when you look at serious psychological distress, and you can substitute suicide attempts or suicidal ideation in there, is that there's no correlation between how often people are thinking about killing themselves. There's no correlation between how often they're admitted for mental health problems or how often they say they have depression with the rate at which they're dying. People are no more mentally ill in one state compared to another, by and large. But they're dying at much higher rates by suicide when they live in states with more guns. If you plotted a line of gun ownership on top of this graph, what you would see is it would track very nicely with the line showing you an increasing rate of suicide. Okay, this renders in 2 dimensions what the methodologically rigorous studies have shown in general. The axes are kind of tiny. I don't know if you can read them, but I think that you would agree that there's one of these things that doesn't belong with the other, right? There are 2 that go together and 1 that doesn't. The 2 that go together are the pink dots and the blue dots. They both show a line, a slope, increasing from the bottom to the top, whereas the green dots look like they're scattered randomly. What the pink dots show is the relationship between household gun ownership in a state and the rate of firearm suicide. What the green dots show is the relationship between non-gun suicide and household gun ownership. There is none. The net effect is the blue dots. As you increase if you live in areas where there are more guns, more people are dying by suicide. Okay. It's sort of intuitive to people when we're talking about homicide that if someone shoots you, you're more likely to die than if they try to knife you to death. But people don't think about suicide always in the same way. But the similarities are actually quite striking. Firearms are the most lethal method people use of all the methods that are commonly used. Many suicidal acts, like homicidal acts, are impulsive. Crises are temporary. And importantly, very few people who survive an attempt go on to die by suicide thereafter. Very few people who survive a suicide attempt go on to die thereafter. What this means is if you can save a life in the short run, you save a life in the long run. Otherwise, we would not see these strong relationships between gun ownership and overall rates of suicide, nor for homicide. Okay, here's a measure of the magnitude of what we're talking about. If you look at women in the high gun states, there were over 4,000 who died by firearm suicide. There were about 500 in the low gun states. Their rates of non-firearm suicide, basically the same. The net effect, 8,781 women in the high gun states died over this 8-year period compared to 5,138. 3,000 women. You can look at the numbers for men, and we're talking about almost 18,000 more men. You can talk about the men who are killing one another, the age group killing one another, and you see the same thing that you do for women and children. These men are using guns in their home, and they're dying by suicide at twice the rate when they live in a high gun state. Okay, so the United States, with our many guns in civilian hands, especially handguns, and with our very permissive gun control laws, has a far more serious lethal violence problem than other comparable developed countries. In the United States, where guns are more available, more people are dying. They're dying by suicide, they're dying by homicide, and they're dying by firearm accidents. The consistency of the finding across different types of studies by different researchers at different times, looking at different populations, is remarkable. There is no credible evidence otherwise. Now, firearm policy is often focused on guns used in crimes. That makes sense when you're trying to prevent lethal homicides that are related to crime, and it's an important focus. But we shouldn't lose sight of the fact that what's most notable about the studies that I've reviewed here and about the strong literature in general is that what is the story they tell more generally about guns, most of which are household guns. The stock of guns we have, the 300 million distributed across 1 out of every 3 homes, the stock of guns matters, and so does the flow. All right, I've spent the last 18 minutes or thereabouts telling you about the relationship between firearms and lethal death in this country. What I haven't told you is how difficult it has been to conduct this science, especially over the past 15 years since the CDC has effectively choked off funding. Few private foundations have stood up in the breach, with the notable exceptions of the Joyce Foundation and the Bonnet Foundation, to name just 2. Mayor Bloomberg gave you a good idea of just how much we're up against, and so I won't go into any further details. But what I will say is that having studied the relationship between firearms and lethal violence for the past 20 years, I still think that we can make a difference. And moreover, we're obliged to act on what we already know, some of which I've talked about this morning. And in thinking about what we should do, I think it's fitting to acknowledge, as Mayor Bloomberg mentioned, that 1 month ago today, almost to the minute, in fact, 20 little children and 6 of their teachers were slaughtered in Newtown, Connecticut. it would be a disservice to those people who died, I think, if in this forum, which is inspired by their memory and committed to reducing the rate of firearm violence in the future, if we didn't take pains to note what is both exemplary about that sad day and what is extraordinary, what is typical and what is atypical. What is typical is that a gun from the home was used in a suicide, and a gun from the home was used to kill a family member. And it's much more likely that those events occur than a gun is used to kill an intruder or injure an intruder. What is atypical about that devastating day is that so many little children and women were killed all at once so quickly with a high-capacity assault rifle. Of the 85 other people who died by gunfire that day, in all likelihood, more than 50 were suicides, and of the 30-plus who died by homicide, most were killed with handguns. Most died one by one. And most outrageously, in terms of statistics, a hugely disproportionate number were young men of color in the inner city. I point to both the exemplary and the extraordinary because the first step in crafting a solution to a public health problem is to identify what that problem is. And that problem is this. Year after year, more Americans are dying by gunfire in this country than are dying in comparable countries across the world. Our nation has not done well by our most vulnerable and our littlest in this regard. We have a uniquely American problem. It's a huge public health problem. We've come together to do something about it today. I pray that we can achieve some measure of durable success. Thank you very much.
Our next talk is by Professor Philip Cook. Phil Cook is a professor of economics and public policy at Duke University. And unfortunately, Professor Cook could not join us today, but we have him ready as a video link. So I'm going to turn to our gentleman here who knows how to make this happen.
Greetings to all of my friends and colleagues in firearms research. I'm very sorry I can't be with you in person, and I hope that this format is not too tedious. I wanted to go ahead and discuss the paper that I'm contributing to the volume co-authored with Jens Ludwig that is a review of the old evaluation that we did of the Brady Act. We published that in 2000 in JAMA, and at the time it was a controversial paper. I think it's directly relevant to many of the discussions that are going on now about possible new legislation that Congress could enact, especially having to do with universal background checks. So what I'd like to do then is to talk about the results of that evaluation and about the interpretation that Jens and I would give to it today, and then go on and talk a bit about the possibility of universal background checks. So to get started, the general topic is selective prohibition with respect to firearms possession. The Gun Control Act of 1968 divided the adult population of the U.S. into two groups. There was the group who were disqualified because they had a felony conviction or because they were illegal immigrants or they were adjudicated as mentally ill or had some other one of the 10 characteristics that's listed in that act. And then there's the qualified population, which is everybody else. The vast majority of Americans then have the right to possess guns, at least by federal law. This distinction was and has been enforced through two mechanisms. One is through the deterrence mechanism, and most commonly through felon in possession laws, where the police, if they pick somebody up who used a gun in a crime, for example, and it turns out that they have a felony conviction on their record or some other disqualifying condition, then can receive an extra sentence in that connection. And the other mechanism for enforcement is by trying to restrict access through the regulation of federally licensed gun dealers. The regulation of transfers was also instituted in 1968 through the Gun Control Act and remained in place right through 1994. It required that anyone who wished to buy a firearm through a federally licensed dealer had to sign a document called a Form 4473, which indicated that they did not, in fact, have any of the disqualifying conditions. And that was it. That was sufficient then to authorize the dealer to transfer the gun to the buyer by federal law. The, of course, obvious end around was what was known as lie and buy, and certainly that happened at the time. So the Brady Handgun Violence Prevention Act, which was implemented in 1994, then strengthened the enforcement effort through, or the regulatory effort by requiring not only that the buyer sign the form, but also that the dealer conduct a background check to make sure that they were telling the truth. Let me just say a few words about the timeline for the Brady Act. That in March 1981, James Brady, who was serving as President Reagan's press secretary, was shot in the head at the same time that President Reagan was shot by John Hinckley. And Brady and his wife Sarah then became leaders in the gun control movement, and through Handgun Control Inc. Became advocates for a particular package of legislation. After 7 years of effort, it was finally enacted by Congress in 1993 and bears Brady's name. The interim set of provisions went into effect in February of 1994, and then almost 5 years later, there was a permanent set of conditions or provisions that went into effect. It was that permanent set that started at the end of 1998 that includes the instant background check system that we're all familiar with. The notable provisions in detail of the Brady Act can be briefly summarized. The interim provisions only affected handgun purchases. They did not cover rifle or shotgun purchases. And furthermore, they, like the permanent provisions, were restricted to transfers by federally licensed dealers. Turned out that only 32 states were directly affected. The other 18 states and the District of Columbia already had a background check requirement, which was satisfactory given the terms of the federal law. What we had during this initial interim period, starting in 1994, then was a requirement that dealers contact local law enforcement officials and wait 5 business days to get a response to see whether or not the buyer was qualified or disqualified. Along the way, in 1997, the Supreme Court actually ruled on one provision of that Brady Act. It was known as the Prince decision, And it's of interest now, partly because, of course, very recently we've had a couple of important decisions based on Second Amendment grounds. But the Prince decision was based on the 10th Amendment states' rights provision, and what it said was, in fact, the federal requirement that insisted that local law enforcement officers or state law enforcement officers conduct a background check, that was overreaching, that the Congress could not do that, so that threw out that part of the federal requirement. But as it turned out, it made hardly any difference, because all but 2 of the states decided to go ahead with the background checks after that. The permanent provisions of the Brady Act came into effect in December of 1998. That expanded the background check to all types of transfers, including shotguns and rifles, and replaced the 5-day waiting period now with an instant background check, which required the dealer to make a phone call, and often would get a response from the FBI or from the state official that was relevant within a few minutes. If there was any question, the default was to go ahead and transfer the gun within 3 days. So that brings us to the story of the evaluation that Jens and I did. The motivation for doing the evaluation was, first of all, that the Brady Act was the most important piece of gun control legislation since 1968, since the Gun Control Act. It was certainly limited in certain respects, but it was the biggest stride forward in that respect that we had seen in all those years. And there were strong claims or high hopes for its effectiveness in saving lives, reducing gun violence. Furthermore, it appeared that because of the way the interim period was structured, that it was logically possible to conduct a strong evaluation, a strong causal evaluation of the effect of the law. And we were fortunate enough to receive funding from the Joyce Foundation and went ahead and did it. The design of our evaluation is a quasi-experimental design. The fact that there were 18 states that were not directly affected by the law looked to us like those states were a control group, that the other 32 states were in effect the experimental group for the effects of this law, and that by comparing the trajectories of gun violence for those 2 groups of states, we could hope then to tease out the causal effect of the law on gun violence. The likely causal mechanisms that we thought were working in the background are pretty obvious in this case, that the background check should prevent at least some felons from buying handguns from dealers, and thus reduce the chance that they would be armed in a violent encounter. If they were nonetheless went ahead and robbed somebody or assaulted somebody and did not use a gun, then the chance that the victim would die would be greatly reduced, because knives and clubs are simply less lethal than handguns. Furthermore, the waiting period that was part of the interim measure in the Brady Act provided a cooling off period, and that we thought that would make a difference for those with a specific intent to assault somebody. And it should be noted, and I'll return to this, that the contrast between the so-called control states and the treatment states only works, this experiment only works if it's reasonable to assume that the control states were not affected by the Brady Act, and I'll talk more about that in a minute. The outcome measures that we used were from the vital statistics. We looked at both the homicide rates broken down by gun and non-gun, and then also looked at suicide rates. We chose to focus on the older perpetrators and older victims simply because, as a logical matter, the Brady Act would have had little effect on those under 21. The handgun sales by dealers were already prohibited to anybody under 21, and that was already subject to a sort of a check, which is that the dealer had to look at the identification provided by the buyer. So what we expected is it was for adults over 21 who would be affected. That turned out to be important in the evaluation for other reasons as well. This all happened during a very volatile period in youth violence, and by focusing on older victims, we were able to pretty much exempt our evaluation from that volatility and look at the more stable rates for older victims. The other thing to be said about the outcome measure is that we thought that suicide in this case was every bit as interesting as homicide, and we included that in the evaluation. So if you look at the first figure, and this one is limited to victims who are age 25 and older, what you see is the rather remarkable fact that the average homicide rate in the control states was virtually identical to the average homicide in the treatment states up until the implementation of the Brady Act. And that's true pretty much every year for the 8 or 9 years before 1994. And that establishes this comparison of treatment to control as being valid, that in fact these two groups of states are very similar prior to the act, and they're being influenced by the same other factors along whether they're demographic or economic or whatever. The two of them are very similar. So what we're expecting to find then, if Brady is effective, is that following the implementation, we will see the homicide rate in the treatment states go down relative to the homicide rate in the control states. But we did not see that. If you, again, look at Figure 1, you will see that the two rates remain very similar following the act. And if anything, the average rates in the control states go down by more than in the treatment states, the difference being very small. In Figure 2, you can see the same kind of comparison now just for gun homicide rates, where the effect, if any, should be concentrated, and we get exactly the same pattern. Very similar rates prior to Brady. If afterwards, it continues to be similar, but if anything, the control states do a little better than the treatment states. Just the opposite of what we might expect. Figure 3 and Figure 4 produce the same results now for suicides involving victims 25 and over. And you can look at those. In that case, there is some gap in the averages, but they certainly follow the same trend. And they follow the same trend before and after the implementation of the Brady Act, with the result that it does not appear that there was any particular effect of the act itself. Beyond looking at this kind of graphical evidence, we also did a regression analysis, what is known in economics at least as the diff and diff analysis, using the panel of states over the period 1990 to 1997. And just what has become a very standard application of causal evaluation analysis, and what we ended up doing was controlling for a few other factors of covariates, but focusing on the implementation of the Brady Act to see whether it made any difference in those states where it had a direct effect. Our findings were just what you would expect from looking at the graphs, that for homicide we found no discernible direct effect. For suicide, we found no discernible direct effect. That both of those conclusions is subject to the qualification that there's a confidence interval around that estimate of a null effect. And for example, for homicide, the 95% confidence interval would amount to the range, a reduction in 13%, all the way up to an increase of 8% in the overall homicide rate. So that gives you some idea of the uncertainty, but accompanied by the basic finding that we endorse the null hypothesis. The first question that might come up in looking at these results, people scratch their head and say, but after all, during that interim period, there were over 300,000 people who were denied the purchase of a handgun. That is over 300,000 times during that 5-year interim period. Somebody went to a dealer, attempted to buy a handgun, and was refused on the grounds that they had a felony record or had some other disqualifying condition. That amounted to 2.4% of all of the attempted purchases. And 300,000 sounds like a big number. We might expect that it would show up in the homicide rate or in the suicide rate. And so what's going on here? But we did some calculations based on evidence from California that seemed pretty directly relevant, which suggested that in fact those 300,000 denials might amount to only about several dozen homicides at best. And that would be true even if they were not replaced with other sources of guns along the way. So that's not enough to produce a discernible effect in the homicide rate, as it turns out. I would say at the time, the most important criticism of our study was that we had ignored the possibility that the control states, in fact, were being affected by the Brady Act, not directly, but indirectly through changes in underground trafficking patterns. Prior to the Brady Act, it was very common for crime guns in states like Illinois or California, Massachusetts, to come from states with very little regulation, maybe in the deep south along the way. And now that there's a federal requirement that establishes regulation in all of the states, then we would expect to see changes in the trafficking patterns, because it became more difficult for gun runners to source the guns in those unregulated states. We did a case study for Chicago later and found that that was exactly true, that you see a very abrupt and dramatic change in Chicago in terms of the percentage of crime guns picked up on the streets of Chicago that were being sourced outside of Illinois from Mississippi or Deep South, where before that was a standard pipeline. So sure enough, it does appear that the control states were affected in that sense by the Brady Act. On the other hand, in Chicago, when we took a look, we could not see any effect on the use of guns in homicide. So big changes in the underground market, but very little change apparently in access by the violent people that were accounting for the homicide rate. And as a result, we're skeptical of the idea that change in trafficking patterns made much difference in terms of gun use. All right, so if we step back and say, well, suppose we were basically right, and that in fact the Brady Act was ineffective, why might that be? And very quickly we can be reminded of the limitations of that act that were evident at the time, are even more evident now. The greatest limitation is that, as it turns out, most criminals do not obtain their guns from licensed dealers. They obtain their guns from the secondary market, the informal, undocumented market, much of which, by the way, is legal, but which is entirely unregulated by the Brady Act. Even before that act with its background check went into effect, There was one study that said over 80% of criminals obtained their guns from some source other than the licensed dealer. So that's the greatest loophole. The second one is that it turns out that a majority of murderers, or at least people arrested for murder, are probably not disqualified. At least they don't have a felony conviction. And we did a study again in Chicago which said 60% of those arrested for murder in Chicago did not have a felony conviction on their record. So in effect, that's another loophole in the law, that the disqualifying conditions do not cast the net wide enough to pick up the majority of violent criminals. The third loophole is, and this was true especially in the 1990s, that the background checks were only as good as the quality of the records that they were accessing. And those records were severely deficient in the 1990s. There's been federal programs of revenue support since then to help the states upgrade their systems and improve the data available for the instant background check. And so presumably today it's more complete than it was in the 1990s, but then it was another important loophole. All right, so lots of reasons, or at least three, to understand why the Brady Act might have been ineffective. At the same time, acknowledging the fact that our study had some limits of its own. So finally, let me try to provide a verdict generally on selective prohibition. Again, reflecting on the study that Jens and I did, the first thing to say is just to remind everyone that our estimates of the effect of the Brady Act are not precise. Our null result leaves open the possibility that in fact it did save lives and that it saved enough lives to pass a cost-benefit test. After all, every 1% reduction in gun deaths is 300 lives saved, and by current standards that would justify $1 billion program or more. So 1% reduction is not anything that our evaluation method could detect, and so we're left unsure about this possibility that in fact there was a small effect, but an effect that was large enough, given the very high stakes of lives saved, to make it worthwhile. And finally, let me just say that the universal background check may, if it were instituted, produce much larger effects than the Brady Act ever could, simply because it would close the private sale loophole, and if that universal requirement could be effectively enforced, then it would greatly add to the efficacy of that law. And I suspect that the additional cost would be relatively trivial. So that's my observations on that old evaluation, and looking forward a bit. I think one way to summarize it is that we don't have enough evidence from our experience with the Brady Act to make a clear judgment about the benefits of possibly going forward or expanding the selective prohibition approach.
Okay, so many of the vulnerabilities that Professor Cook identified, we're going to be addressing in our subsequent presentations. We're going to alter our schedule slightly and take our 10-minute break now. So I'd appreciate it if everyone could be back here within 10 minutes. That would be 11:16, and we will get going. Thank you.